Assalamualaikum, my name is Muhammad Deni Imran. So I would like to explain about the introduction of optical fiber in medical. An optical fiber is a thin, flexible strand made of glass or plastic that carries light from one end to the others. It composed of a core with a high refractive index, surrounded by cladding with a lower refractive index. Light travels through a core by bouncing off the cladding and process called total internal reflection. Optical fibers were initially used in endoscopy to see inside the body by transmitting light and images, allowing doctors to visualize internal organs without large incision. Recent advancements have expanded their use in advanced imaging and diagnostic, including optical coherence tomography (OCT). This technique creates a detailed image of tissues used in eye exam and more. Fiber-based confocal microscopy. This method provides high-resolution images of cells and tissues. Various spectroscopic techniques. These include reflectance, light scattering, fluorescence, and Raman spectrography, all of which help in diagnosis disease by analyzing light interaction with tissues. These advancements have significantly improved precision and non-invasive diagnostic capabilities in the medical field.
History in optical fiber. In 1952, physicists based from UK named Narendra Singh Company has created the first actual cable of fiber optical based from John Tidal experiment in 1982. The first fiber optic endoscope is first developed in 1957. Fiber-based sensors and optical fibers have set an increased utilization for diverse biomedical applications. Optical coherence tomography, sensing delivery, laser beam radiography of digital imaging and illumination are originated from optical fibers. How they evolve over time. Earliest application of optical fiber in medicine were in imaging. The optical fibers bundle have been used to transmit images from the proximal end to the distal, where the doctors and physician can target tissue image in actual time. This equipment using this technique is known as an endoscope. Highlights key milestones or innovation that have led to their use in medicine. Technology of fiber optic has played an important role in the medicine advancement. In endoscopes, fiber optic cable is used. It is small, has a lead with an adjustable tips and a camera at the end. Endoscopes such as laparoscopies and colonoscopies are used in various medical operations by these technologies, it allowing the doctors to detect diseases and observe organs without invasive surgery needed.
There is two main types of optical fiber used in the medical field. First, the single mode fiber. This fiber have a very small core diameter, typically around 8 to 10 micrometer. The small core size allow for only one mode of light to propagate through the fiber. Single mode fiber are used in applications where high power transmission and long distance are required, such as in laser surgery and optical coherent tomography. Second is the multimode fiber. This fiber have a large core diameter, typically around 50 to 1500 micrometer. This large core size allow for multiple modes of light to propagate through the fiber. Multimode fiber are used in applications where high power transmission is not as critical, such as in endoscopy and illumination.
Application of optical fibers in medicine. First one is endoscopy. Optical fibers are crucial in endoscopes, which is visualize internal organs by transmitting light and images. So doctor can see inside the body without large incisions. For example, gastrointestinal endoscopy allow examination of stomach and intestine. These technologies provide minimally invasive procedures and improve diagnostic capabilities through clear images of internal structure. Next, laser surgery. Optical fibers delivers lasers energy for precise surgical procedures such as cutting, burning, or destroying tissues with high precision. In eye surgery, such as LASIK. Optical fibers reshape the cornea in eyes to create the vision for the patient. This method offers high accuracy in targeting specific tissue and reduce recovery time due to its minimally invasive nature. Third, diagnostics. Optical fibers are used in various spectroscopic techniques to diagnose disease by analyzing light interaction with tissues. Example include optical coherence tomography (OCT), which creates detailed images of tissues, and fluorescence spectroscopy, which detects specific molecules. These techniques enable early disease detection and provide non-invasive, detailed information. Lastly, monitoring vital signs. Fiber-based sensors monitors psychological parameters like temperature, pressure, and oxygen levels. For instance, blood flow monitoring is essential in critical care and surgeries. These sensors offers continuous monitoring, providing real-time data and enhance patient care and management.
Predicting upcoming trends in medical science, the biomedical industry is experiencing an increased demand for miniature sensors driven by advancement in surgery procedure and analysis. The fiber optic sensors are crucial in disease treatment, biomedical research, and drug discovery, and there is a developing interest in supervising a larger number of biochemical and physical parameters in vivo. Fiber optic technology is related with the use of light pulses using data transmission that is usually made of glass or plastic that travels along a fiber. Transmission in optical fiber communication always uses metal wires because the signal will travel with less damage. Flexible and efficient image transmission is usually used in demanding applications such as borescope, endoscope, and other imaging systems. Optical fibers for image conduits often consist of bundles of hundreds or thousands of individual glass or plastic optical fibers. Discussion on emerging technologies and research areas. Through refraction, Daniel Colladon and Jacques Babinet have shown light guidance, which is likely to be the basis of optical fibers. In Paris in the early 1840s, a general demonstration by John Tyndall was included in his lectures in London after 12 years later. A dramatic increase can be observed in the pattern count for fiber optic sensors used in medical application based on observation in the last 8 years. Fiber optic sensors are used in both non-invasive and invasive applications. Their small size and non-governing properties cause them to be used. The human cavity can be easily inserted fiber optic sensors for this characteristic or reasons. In addition, it is not electrically conductive. Also, electromagnetic disturbances caused by electrical equipment such as wireless communication, electrosurgery, or MRI do not affect fiber optic sensors. Fiber optic sensors can be categorized by so many different applications. According to the diversity of the application, we can categorize fiber optic sensors with many applications according to the variety of application areas. For example, in vitro, for body fluids, gas examination, or tissue sample. In vivo, non-invasive is the name of the technique, like optrodes places on the skin. In vivo, invasive methods such as catheter or other endoscopic instruments.
To summarize optical fiber as discussed in this session, it is a medium for transmitting information in the form of light from one location to another. It is useful, practical, versatile, and powerful technology that have assisted humans throughout our history in performing visual examination and diagnostic on both sick and healthy patients. Optical fiber are classified into two types, which are single-mode fiber and multi-mode fiber, based on total internal reflection. The superior capability of fiber optic in transmitting a wide range of light and energy in medical systems which require high stability, transmission efficiency, and biocompatibility, providing numerous options for medical equipment development. Optic has been and will continue to be driving force of medical advancement. allowing for development of previously unimaginable devices in the future. With this in mind, we hope that this video presentation will provide viewers with basic understanding about optical fiber in medical and their application. That's all from us. Thank you.